Hello everyone! Welcome to my YouTube channel. It's a Nutri-Day today. Kini ang inyong kauban sa impormasyong pang-nutrisyon ug uban pa ang inyong Nutri-Inday. Ug para sa mga bago pa sa akong channel, ayo gayud kalimot og pag-click sa subscribe and notification bell para mahibawan ninyo ang uban pang mga nutrition-related topics natong pagahisgutan. And for today's vlog, we will talk about the common situations that can affect infant and young child feeding. Always keep in mind the concept of infant and young child feeding. Kailangan isipon nato na sa unang 6 months ni baby, breastfeeding lamang. Wala na kailangang ihatag, no? Sa unang 6 months ni baby. And mula 6 months, tagaan pod nato siya sa iba't ibang angkop na pagkain. Ug mo na itong ginatawag na complementary food. Pero, naatay mga dating pagtuo, no? Local belief na makahadlang nganong dili mahatagan si baby sa wastong nutrisyon nga gikinahanglan sa iyang lawas. Ug mao na ang atong pagahisgutan sa karon na vlog. Atong hibaw-an no ang kaning mga local belief ba tama ba ni siya or dili o unsa atong himuon para ma-address ning mga problemaha. First, local belief. Ana sila ang colostrum daw na ay mga mommies, other caregivers na ang pagtuo nila. Paano kung maka-encounter kag mommies na ang ilang pagtuo sa colostrum, kailangan daw ilabay, i-discard. Kay para sa ilaha, isa daw kini ka expired milk and dili makaayo. So, how to address that one? Always advocate the importance of exclusive breastfeeding and i-educate nato sila unsa ang colostrum. Ang colostrum kay naa siya ginatawag na antibodies and other protective factors for the infant. What do you mean by antibodies? Antibodies and other protective factors for the infant. Ibig sabihin, it contains antibodies na mo-fight against infection para dili paspas matakdan si baby. Nganong yellow man ang atong colostrum kay rich siya in vitamin A. And imagine, the newborn has a stomach size of a marble, no? Sama sa isa ka marble lang ang size sa iyahang tiyan sa newborn. And a few drops of colostrum fill the stomach perfectly. Enough na to siya. Paano na lang kung tagaan nimo siyag tubig and other substances sa newborn? Of course, the stomach is filled and there will be no room for colostrum. Munang huna-hunaon. No naapatay mga mothers, no? Maghatag og juice, water, asa na masulod si colostrum. Muna atong isipon ug i-advocate sa to mga mothers. Now, a colostrum is a milky fluid that comes from the breast in the first few days after giving birth, before the true milk appears. Unsay naa kay colostrum? Ang colostrum contains proteins, carbohydrates, fats, vitamins, minerals. It has antibodies and fight disease-causing agents na pwede niyang labanan ang bacteria and viruses. Now, pwede na nimong ma-explain, ma-aware si mommy na dili na siya expired or discarded na gatas. Next, local belief. Naipagtuo na kapag low birth weight daw ang baby, pasabot ana less than 2.5 kilograms or premature siya, gamay daw kaayo na and weak to be able to suck or breastfeed mo nang di na lang daw patutuyon. Unsaon na nimo pag-address ana na problem? Always keep in mind that the baby should be kept in skin-to-skin contact with the mother. Kay makatabang ni siya para ma-regulate ang iyang body temperature and breathing. and keep him close contact with the breast. A full-term low birth weight infant may suck more slowly. How to address that one? Kapag low birth weight, allow the baby time para maka-express. Gatas mama. The breast milk from the mother of a premature baby is perfectly suited to the age of her baby and will change as the baby develops. Mother needs support for good attachment. Feeding pattern? We'll say feeding pattern, of course. Give a long, slow feeds and keep the baby at the breast. Direct breastfeeding may not be possible for several weeks, but mothers should be encouraged to express breast milk and feed the breast milk to the infant using a cup. So, kung dili makaya, labi na kay gamay pa kayo si baby, no? Low birth weight. No, pwede ka mag-express og gatas sa imong tutoy, and you could use a clean cup para ma-introduce to sa imong baby. So, walay rason na maski low birth weight siya, wala kay reason na di ka magpa-tutoy sa iyaha. Remember that crying is the last sign of hunger. Earlier signs of hunger include a combination of following signs: being alert and restless, opening mouth and turning head, putting tongue in and out, sucking on hand or fist, and one sign by itself may not indicate hunger. So explain that the mother can respond by feeding the baby when she shows the sign. Another local belief: paano kung may cleft lip and cleft palate or inani ang situation sa baby? Pwede na ba dili magpa-breastfeed si mommy? How to address this local belief? Remember, kapag naiinani ng mga situation, remember to refer the infant to a medical professional for treatment as the use of obturator or surgery. If your baby tends to choke and lick the milk from the nose, mo apply kag different attachment methods, proper attachment, or ginatawag na modified football hold o straddle position. Ang pasabot ani mo ni siyang ways of proper attachment sa baby. No? Natay mga strategy sa mother para ma-introduce ni mong tarong ang imuhang milk. Okay? This is called as the modified football hold. Of course, advise the mother to position her nipple on one side of the cleft. Then use her thumb to feel the defect. Or you could the mother could express milk, no? Pwede niya mag-express milk sa cup and then use a dropper para ma-introduce ang iyang gatas sa baby. Okay? So, walay reason si mama na dili siya makapatutoy kay nainato na kondisyon niyang anak. Of course, pwede gihapon siya maka-exclusive breastfeeding. Next, paano kung twins ang imong anak? Pwede ba gihapon ka makapag-breastfeed or dili? Now, a mother can breastfeed both babies. According to the Department of Health, the more baby sucks and removes milk from the breast, the more milk the mother produces. A mother of twins produces enough milk to feed both babies if the babies breastfeed frequently and are well attached. The twins need to start breastfeeding as soon as possible after birth. If they cannot suck immediately, help the mother to express and cup feed. Build up the milk supply from very early to ensure that breast make enough for two babies. Now, these are some of the positions that will help the mother to find some of the comfortable positions para breastfeed sa iyahang anak. So, kapag twins ang imong baby, of course, wala excuse. You can apply the tandem method. Okay? So, naaday tayo mga nakalakip na lahing positions of breastfeeding. We could apply the cradle hold, football or clutch hold, We have the side lying hold, standing position, reverse cradle hold, and we have the laid back position. So these are some of the different breastfeeding positions. And then, tuluan nato si mama para na ay good attachment ug makasak si baby og more milk. Ayan. Next, paano kung mag-refuse si baby na mag-breastfeed? How to address this local belief or problem? Usually, refusal to breastfeed is the result of a bad experiences, such as basig pagkarga sa iyang mama, na pressure ang iyang ulo, no, na i-pressure sakit na, or refusal when na ay mastitis. When we say mastitis, maghubag ang tutoy sa mother. Now, sometimes this mastitis changes the taste of the breast milk. It will become more salty. Pero dili na siya salty on and on, no? Check the baby for signs of illnesses. Nga nung mo-refuse siya sa pagtutoy sa imo ha, na pwedeng nga nung maka-interfere sa pag-feeding. Include the signs of thrush in the mouth. No, basig na aday siya luas, 'di ba? Sakit man na siya. So i-check nato si baby, no? Or i-refer nato si baby for treatment kung naa siya sakit. Let mother and baby try different positions as long as comfortable sila. Wait for the baby to be wide awake and hungry pero wala gahilak before offering the breast, and gently touch the baby's bottom lip with a nipple until he opens his mouth wide. Do not force the baby. Ayaw ninyo pilita si baby na mag-breastfeed, and do not try to force the mouth open or pull the baby's chin down, and this makes the baby refuse more. Kaya, do not hold the baby's head para dili siya ma-pressure. Of course, you can also express and feed the baby by cup until the baby is willing to suck. Express directly into the baby's mouth. Avoid giving the baby bottles and teats or dummies because natay balaod na nakaklakip bahin ni ana. What is makalabag ka sa Executive Order 51, the Milk Code of the Philippines. Next, another common situation or local belief na gusto natong i-change. Ana sila na kapag na daw new pregnancy si mommy, a new woman must stop breastfeeding her old child as soon as she learns she is pregnant. Tama ba na dili na siya magpatutoy niya, buntis man siya? So, Diana, it is very important that a child be breastfed until 2 years and beyond. A pregnant woman can safely breastfeed her older child, but should eat very well herself to protect her own health. Because she is pregnant, her breast milk will now contain small amounts of colostrum, which may cause the older child to experience diarrhea for a few days. But don't worry, ang colostrum na alam siya ginatawag na laxative effect. After a few days, the older child will no longer be affected by diarrhea. Remember, as what I defined unsa ang colostrum a while ago. Now, sometimes the mother's nipples feel tender. However, it is perfectly safe gihapon to breastfeed two babies and will not harm either baby or the mother, and there will be enough milk for the both. Ayaw jud mo kaguol, okay? Now, another belief, a mother who works outside the home or away from her mother, the baby cannot continue to breastfeed her infant exclusively in the first 6 months. Paano daw kung nagtrabaho si mommy? Of course, if a mother must be separated from her baby, pwede gihapon siya maka-express sa iyang breast milk and leave it to be fed to the baby in her absence. Help the mother to express her breast milk and store it to feed the baby while she is away. The baby should be fed this milk at times when he or she would normally feed. Teach nimo ang caregiver how to store and safely feed express breast milk from a cup. It may be stored safely at room temperature for up to 8 hours. And mother should allow infant to feed frequently at night and whenever she is at home or with the baby. Mother is able to keep her infant with her at the work site or to go home to feed the baby should be encouraged to do so and to feed her infant